Since the beginning of the COVID-19 pandemic in PNG, the National Capital District has recorded over 7,000 confirmed cases and over 100 deaths so far, according to statistics from the National Control Centre this week. These are the highest figures compared to other provinces. The Port Moresby General Hospital, the country's largest referral hospital, is currently experiencing the worst scenario it has ever come across since its establishment, especially in terms of patient numbers and deaths. Hospital CEO Dr. Paki Molumi echoed some alarming news to the public this week, revealing the reality of the situation.
So we, as the city's hospital, serving over 1 million population of the National Capital District, Central Province, as well as parts of Gulf, is reaching a crisis point. We lost 3 kids 3 days ago. Children I'm talking about, who died of COVID. This surge is not discriminating anyone, it's affecting everybody. 50 deaths on arrival. These are people who died at home, brought to our mortuary to be stored. On Tuesday, we received 40 deaths on arrival. On Thursday, yesterday afternoon, we received 30. That's in the afternoon. The numbers may have gone up in the night. This is something that we have not seen in the previous years or months. The number of people who are coming into our emergency department gasping for air has increased, and also the number of deaths that are seeking to be stored in the mortuary has also increased.
With the ever-growing population of the capital city, especially with the Delta strain now, serving those affected is proving difficult.
This hospital has been under enormous stress for over 20 years now, because it was built, as I say, to cope with a catchment population of about 200,000. But now you may come up over 500,000 now inside the national capital, like using PMGH or some housing long. And so we've been under stress long time pinis. But now this COVID sick here, and we knew it was coming. We just had the timing a little bit wrong because we didn't, it's a new disease. So how can you understand everything about a new disease before you get it? It took us a year or two to understand how HIV would affect our population. And it's taken several months for us to understand how COVID would affect our population.
Senior medical doctors at PomGen have realized that the original COVID-19 infection mostly affected middle-aged to elderly people and not so much of the younger population. But the emergence of the Delta variant has a different effect. Professor Glenn Mola, head of obstetrics and gynecology at the hospital, explained this in an interview with EMTV News this week.
So we thought, looking at other countries, that the original variants are all wild strain, all kind number 1 COVID, and by come up in big plastic or some been come up long Italy, in UK, in kind place or some. But we didn't realize at that time that these original strains of COVID were not very dangerous to young people. So PNG's got a population that's 75% under the age of 30. So this demographic, kind structure, age group, population bulimia, is the main thing that protected us from a serious epidemic last year and the beginning of this year. But this Delta strain, it's much more infectious. Instead of infecting 1 or 2 people in a household in 24 hours, it infects 4 or 5. So it's twice as infectious. And not only that, it causes sickness, more severe sickness in people. And emno mari lo liangpla. Or liangpla too is a big plastic, including some children, unfortunately.
Dr. Mola also emphasized on the risk that pregnant mothers face during this time, where he says they are highly vulnerable to various diseases, including COVID-19. The intensity of the situation at Pomgen is having an effect on the rest of the city, and NCD Governor Powes Pakop made this statement earlier in the week on the way forward.
If we look at lockdown, we've tried it before in first wave, second wave, and you all have seen the result of it. We've spent a lot of time, effort, energy, resources. NCDC, for example, city manager is here. This year, I think we've spent nearly going up to 8 or 9 million. Support the police and all the stakeholders to do the protocol enforcement in the city. But the reality out there is that it's hard for us to enforce the protocols. So I'm not rushing, and I don't want us in the city to rush to a mechanism or strategy that is high risk of not working.
He said people in the city need to be self-reliant in looking after themselves to stop the spread and infection of COVID-19.
Most of the people who are getting infected, 95%, are unvaccinated, Olinoxim vaccine. Most of the people who are dying up to now are unvaccinated. There is an issue or a debate here and there whether one or two got vaccinated and died. It's a debate. But the reality, hard fact is that 95% all Olinoxim infection, they are unvaccinated or they decided not to get the vaccine.
With the experience of past lockdowns soon after initial cases of COVID-19 were confirmed in NCD, Governor Pakop preferred for people to be vaccinated to achieve the targeted herd immunity of 160,000 rather than going into lockdown.
I am very, very sensitive to the effect it could have on our livelihood of our people because they depend on cash, and the government doesn't have cash to give to our people at this time. So as much as possible, I don't want the restriction to affect the capacity of our people in the city to earn an income.
The governor's comments had varying reactions to it later in the week, with some calling on the governor to lock down the city. Former Health Minister Sepuka Temu, a medical doctor by profession, was one who disagreed with Governor Pakop's initial comments.
I want to say that I was not happy with the governor's decision yesterday because it's very, very clear to everybody that the current wave, particularly in the areas that the news has been reporting on, and now in NCD, is really causing a lot of issues to all of us. Firstly, the death of many, many citizens in the city and in the country, and also the Port Moresby General Hospital CEO did report that 2 children have now died of COVID.
Sepuka, who is also Abau MP, said the crisis situation at Pomgen is enough for Port Moresby to go into a lockdown to reduce transmission.
It's very, very visible in the NCD and reported very well by the media and all of you that the beds are really packed. Staff are really stressed. The mortuary is really full. So they're extending mortuary space, they're extending bed space, and they're asking for staff for relief. That is enough evidence that the system is fully stretched. That is because every day, as you have been reporting, every day cases are coming in. The ambulances are doing 5 times more calls than they've ever done before. The emergency staff are seeing more emergency patients than they've ever seen before. The mortuary staff are seeing more death than they have ever seen before. And so what more do you need?
Sepuka suggested a managed form of lockdown rather than a total lockdown, which would have social and economic impacts.
And my call to the governor is, while I agree that the vaccination push is the way to go, that will not solve the immediate problem of the systems being overstretched. We need some relief. And because all of us know that COVID moves from person to person, as people move, as crowds move, then COVID moves. And so the world has demonstrated, and we're very close neighbors, Melbourne and Sydney, just down the south, that lockdowns do help. I'm not saying the tightest lockdown. No, there is a managed lockdown. For example, emphasize on controlling the crowds where the crowds are. When the last time that the NCD engaged the police personnel, I was always very happy that the police personnel had tents outside where the crowds were going, and there was very good control. This was only about 3 months ago. That's the type of thing I'm talking about. That where there are crowds, the social distancing orders cannot be met without police presence, because our people are traditionally social beings. And so when you just give an order without policing it, people never listen, and we know people have never been listening. This is why the wave, particularly with Delta variant, we are in real trouble right now.
Later in the week, with advice from various stakeholders, Governor Pakop held talks with relevant leaders to find the appropriate way forward for city residents.
We are talking about it now, the lockdown. I have discussed with ACP Wagambi and Metsupi Kumu. I've discussed with Dr. Sapuri, who is the chairman of the PNG Medical Board. I'm waiting for Secretary Health and our three CEOs to give their opinion today.
He urged the public to stop social gatherings that involve many people to enable the situation to be under control, and so it may not be necessary for a lockdown in the city.
I want to appeal to our people. It's really up to them in the city. If they self-regulate themselves, wear masks, not go along house crying a boom boom number. That's how we do a big spreader, or we transmit, because virus Ronnie Goy come. We carry it around. So if we start going around and stop all the house cry and stop all the booms or stop all the big gatherings, then we will break the transmission. Then there's no need for us to go to a lockdown.
We know that the doctors, nurses here at the TAC and at Port Moresby General are doing everything possible that they can to save lives, but unfortunately there are so many patients and the severity of illness is so great that it may not be possible to save everyone.
But, we see that the trend of death, especially with kids and the young population, may possibly be attributed to the Delta variant, which is currently, active. There is active community transmission in the city.
Given the escalating situation at PomGen that has reached crisis point and many fear the worst, concern for health workers is also growing as requests have been made for more health workers to join the team and help save lives.
So I really feel sorry for the health staff who are there 24/7. I really felt sorry for not only for them there all the time, but mentally and spiritually. They are really, there's a lot of pressure on these human beings called health workers. And so I believe that the way to help at this stage, next 2 weeks, is to have a lockdown, a managed lockdown.
So as the vaccination rollout continues in the city and around the country, Port Moresby residents not only hope for the situation to be under control with reduced case and death numbers, but they also hope the crisis does not either put them out of jobs or go without food. City authorities are expected to make major announcements in the coming week on what is to happen in the immediate future.